Thank you very much for talking with us, Dr. Reid. Could you please tell us a bit about yourself?
My name is Dr. Esan Reid. I'm an emergency medicine specialist for 5 years, and I've been a practicing medical doctor for approximately 10 years.
What do emergency medicine specialists do?
Okay, emergency medicine specialists, we manage all the emergencies. If it's a surgical emergency, for example, acute appendicitis, multiple traumas, we also manage medical emergencies such as asthma, heart attack, complications of diabetes. We also manage obstetric and gynecological complications such as ectopic pregnancy, abortions. Basically any emergency condition you can think of, any condition that can endanger the life of the patient, we manage those types of patients.
So how does all that fit into someone who's critically ill with COVID-19?
Okay, the first patient the index patient that we had, she was a critically ill patient, and of course she presented to the emergency department. It was life-threatening, and we had to do multiple procedures to save her life. Generally, as it is now, because of the systems in place, we are not really seeing so many COVID-19 complications because we have a screening system, we have the hotline. So there are measures in place to capture these patients before they actually become critically ill. So unlike the first patient, we're not seeing critically ill patients come into the emergency room with COVID-19.
What is your work then in the unit?
Okay, I'm one of the supervising doctors, and even though we have the pandemic of COVID-19, there are also other medical conditions that is happening presently. Our hypertensive patients are still hypertensive. Our diabetic patients are still diabetics. People are going on the road, we have accidents, we have trauma, so there are still emergency conditions happening in the country apart from COVID-19. So ideally, we would want to manage those patients and not necessarily the COVID-19. There's another avenue that those patients would take in order to enter the hospital.
So you work both areas, patients other than COVID-19 at the moment?
Yes, we see, if the patient is working ideally, we see non-COVID emergency. The COVID-19 patients, they would go to E Street and they would be triaged there, enter the hospital. Even the critical patient, but that being said, we can also see patients critically ill with COVID-19 entering through the emergency department. Presently, the emergency department is set up in such a way that COVID-19 complicated patient does not mingle with the average patient because we don't want exposing the general population to COVID-19 when they come to GPSA accident and emergency.
How many hours do you work?
In a week, about approximately 48 hours in 1 week.
Okay, so you're not pushing a lot of overtime?
No, and in this time being an emergency doctor is high stress. So you need your rest. You need your rest. So working 50, 60 hours, no, that is not recommended.
What kind of support is there for you as a doctor and the other doctors working in this unit?
Okay, I can talk about my personal experience being on quarantine because all of the doctors and nurses who were in contact with an index patient, they all went on quarantine, and the hospital did lend support. They called even after we came out of quarantine, they checked in on us if we needed any mental support, any social support, psychological support. The hospital is there. And presently, we're being given PPE to protect ourselves.
Thank you very much.
Okay.